Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
Welcome to Centerpoint. I'm your host, Dr. Ron Anbar. In this show, we will discuss ways that we can journey to our own centers. This can help us access our inner resources to improve our physical abilities and health, our mental strength, our emotional well-being, and our spirituality. Today, we're joined by a very special guest, a patient of mine named Pierce. Hi, Pierce. Thanks for being with us.
Hello. How's it going?
Great. So I have known Pierce I was looking for more than 6 years now. We've been working together on many issues over the past several years, and I thought telling part of your story would help our listening audience understand about your own journey to the center, the powers of hypnosis, and really resilience and strength that you demonstrate so amazingly. So maybe we can start by, if you can tell a little bit about how you ended up seeing me in the first place. What brought you to see me?
So, back a long time ago, when I was at probably one of the most pivotal points in my medical journey that brought me to where I am now, I was diagnosed with a disease, autoimmune disease called PANDAS. And that led me through some treatments. And then I was dealing with the psychological effects of that and how it made it easy for someone like me to develop those kind of things like OCD. And by developing those things, I didn't really know where to go. I was seeing a lot of different therapists, but I was having trouble finding someone that was able to connect with me in a way that related to mistreatment in the hospitals and stuff like that.
So if I can just interrupt a second to give a background. So PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. That's a mouthful. And so let me just, if I can clarify a bit about that. And so I think we met when you were 14, 15?
Yes.
So I think you contracted it when you were around 11, and what happens is that people get strep throat, and the body creates antibodies to fight the strep throat. But those same antibodies end up attacking the brain, and the brain gets inflamed. And as a result of that, children overnight will develop severe anxiety or OCD. Those are the most typical obsessive compulsive disorder, most typical reactions to PANDAS. And then this can lead to a lifelong issue with anxiety and OCD. And interestingly, when people first develop PANDAS, if you give them an antibiotic for the strep, their PANDAS symptoms, the psychiatric symptoms, improve because their inflammation goes down. But you can't give antibiotics forever, and even after the infection goes away, people are sometimes stuck with their symptoms. And I wonder, Pierce, can you share, like, you had pretty severe OCD. How did it affect your life before we met?
So, yeah, it's very true about the antibiotics. I did notice that at one of the lower points of my life, when I was in the hospitals and in the psych ward, for instance, when I was dealing with the severe OCD, there was definitely a moment where I actually had an infection that was unrelated to what I believe to be unrelated to the PANDAS, where I believe it was like a sinus infection or something, or maybe I forget exactly what it was, but they ended up giving me antibiotics for that, and that completely changed how I was able to deal with the OCD, and that kind of was like a little bit of an indication that this was kind of before I knew about the pandas. As for your question about the OCD, I mean, I was in a place where I wasn't able to live a normal life. I was definitely stressed out 100% of the time, obsessing on just about everything. And, I hadn't been in the public school system for years, since 5th grade. And at that time, when we met, that was around what would have been the end of middle school, before I actually was able to come back from that.
So is the reason you didn't go to public school for a while was because everything was overwhelming as a result of the obsessions? Is that what was going on?
Yeah, I mean, I didn't feel comfortable doing anything, basically, because, it's like life was in a box for many years, because, like, you can't, anybody that has experienced OCD or something like it knows that it feels like you're trapped in your mind, and it affects how you are able to interact with the world, and to an extent where sometimes it becomes so overwhelming that you're not able to get out of that mindset.
And so you went the traditional, quote-unquote, psychiatric route, and you mentioned you were in the hospital. That was for treatment of the OCD?
Yeah, I believe that was the main thing, and then just, the associated things that go with it, for just weight loss, because I wasn't eating because of the OCD, and, they put me in various different wards, sections, transferred me from one hospital to another, went through a lot of medications that I wasn't fond of.
So they did everything. Were you sent to therapy? Did you see therapists as well?
Yeah, but the thing is, like, the therapists that I've seen before I saw you, it was mostly like the clinical way of handling things, like not very emotional. Like, one thing that we do is, there's no agenda. It's more just like you described it in the book, right? It's like you're the cast, allowing the patient to heal, not necessarily trying to force the patient to heal. It feels like a lot of therapy, or most of the therapy that I was in, it felt like they were trying to push this agenda of, like, okay, we'll write down all of your rituals, and then we're going to stop one at a time, or we're going to start doing exposure therapy with all of the things that are, emotionally hard on you, or, rather than just allowing me to take things one step at a time when I'm ready.
So the book you mentioned is my book called Changing Children's Lives with Hypnosis, A Journey to the Center, and I do tell stories about the approach I used with Pierce in the book, which is meeting the patient where they're at. And I'm hoping we can spend some time now. Maybe if you can think back to when we met, what clicked? What did I offer you that you said, maybe this is different? Because your journey towards recovery, which is remarkable, is a journey that other people could take if they become aware of the power within. So how was I able to reach into the dark and help you figure out that you can help yourself?
It was two things mainly. I remember vividly the first time I met you, despite how long ago it was. It was the key thing there was a sense of, I forget the exact words that you said, But one thing that I had done for so many years is, with OCD, you're trying to control your situation and your environment. And every single one of my therapists would, to some extent, allow me to control the situation for whatever reason. Maybe they want me to, they want me to feel comfortable. But that's not what I necessarily needed. I didn't need someone to push me, but I didn't need somebody to allow me to push them. Like, for instance, to have them engage in rituals with me in order to make me feel comfortable, for instance. I remember when we first met, I mean, there was already something there, like, I knew that this was just like an energy or a vibe. But outside of that, from just direct speaking points, I remember you said something along the lines of that, that you're, I don't know exactly what you said, but it was something along the lines of, like, that you wouldn't be engaging in the OCD rituals, and that, that you're here to help, but you're not necessarily here to... Do you remember?
I don't remember that specifically. What I do remember is what you told me at the end of the visit. It's clear as day. You said to me, I think I want to work with you because I can't manipulate you.
Yeah, exactly. That's it. Because that's kind of what I was saying, because it feels like, when you're in a state of desperateness, right, and you're really upset and you really just want to feel safe, you end up manipulating your environment in order to control it, right? And that's a big part of the OCD. The OCD is manipulating you to manipulate your environment, right? And so, for once, I felt like that I wasn't able to do that, which is a big thing, because that's like one of the first steps in being able to actually trust somebody to teach you and help you recover, is to know that you have somebody that's like a strong, like, leader. You know what I mean?
I agree, and I think that the fact you're able to perceive it at a relatively young age, I thought, it started indicating to me that the special person that you are. So we had that first step. Do you remember then over the next few weeks how you turned your life around? I mean, I remember within a couple of months you were talking about returning to school. So what were the steps that took you from being overwhelmed with life and staying in your room much of the time to permitted you to get out there? Do you remember?
I'm going to be honest with you, I don't remember too much of the specifics. I do remember that that it was a long process and it was slow, and that was the first time I was ever allowed to do that and to take my time, which I know that helped a lot. I remember that we had a lot of conversations about encouragement rather than trying to like in my history, it's been a lot of people telling me that I need to overcome certain things, but you sort of, just were able to tell me that I'm going to accomplish these things in my own time regardless, and that I'm capable of it, rather than forcing me to expose myself to uncomfortable situations. Just open the door to the things that I could grow.
Right. So I think that's a key part to what I believe good therapy is, which is supporting the patient on their own journey, not imposing my idea of what the journey should be like. So that's one important part. And the other part that I tell patients a lot is what you just echoed, which is take your time. This is on your time, not my time. And I believe in you. You can do this. So I'll remind you that what we did, I think on our second visit, or third visit, I taught you how to do self-hypnosis, which in your case, I asked you to imagine going to a place of your choice that would be relaxing and learning how to practice calming yourself on a regular basis whenever you need to. And actually, in the last segment of the show today I'm going to teach the listening audience how to do that for themselves. So you'll hear more about what Pierce learned. And then the next big step was learning how to interact with your subconscious. Do you remember with the fingers how they work? Can you explain that? Or I guess we didn't use the fingers. We actually, when I taught you how to, I tried to teach you how to have your subconscious move your fingers, but we ended up finding out that it worked better if I pulled on your arm. So when you tried to, you would hold your arm bent, and when I pulled on it, if your subconscious said yes, you'd stay strong, and if your subconscious said no, you get weak. Do you remember the early times we did that together?
Yeah, of course. I mean, the subconscious is such a untapped reality that not a lot of people really understand. It's like there's so many things that your subconscious knows about you and the situations that you're going through, especially OCD. And there's a lot of things that, with hypnosis, for instance, like you were talking about doing self-hypnosis, right? And, I mean, talking about the OCD, that was extremely helpful in that position. But also with pain, that's a big thing. We're going to talk about doing self-hypnosis with pain?
Yeah, we'll talk about that a little bit later. Absolutely.
Okay, cool. What was the question?
So the question is, when you start learning to use the subconscious, what do you remember about your early use of the subconscious?
I remember that it felt like there was more information out there, or inside, I guess I should say, than I realized, and that there's a lot of things that we kind of glance over in our everyday lives that can be unlocked. Like, for instance, the ability to stay calm and the ability to stay tranquil is something that has a lot to do with the subconscious. It's like how our thoughts are perceived and how we're dealing with those thoughts. Like, for instance, with OCD, a lot of it can come from trauma from the past. A lot of that can come from different, things that have stressed you out over time. And using, for instance, like the subconscious mind to go back and to interact with those experiences and to comfort those experiences, maybe in a place of your mind that you didn't even know was still stressed out or was still going through this grief, can alleviate a lot of the boundaries that are kind of in between you and where you want to be in your life.
How did knowing that you had this power within change your self-image?
That's a good question. Let's see. Self-image. Could you explain a little bit more?
Well, what I'm wondering is that most people don't realize they have the subconscious in them, and they don't realize the power of the subconscious. And you became more aware of it over time, and we keep learning more and more, even to this day, about what the subconscious can do. So as you become more aware of the subconscious, does it change the way you think about yourself, your relationship with the world, the relationship with people you care about, and even how you think of your own abilities? Does that change?
Let's see, how would I put it? If we're unaware of all the things that are happening in our subconscious mind, for instance, we're talking about advertisement, right? Like, subconscious advertisement is everywhere. And if we're unaware of its effects on us, then that just explains kind of like what it feels like to be unaware of the subconscious mind. When you become aware of the subconscious mind, I guess it opens up a lot of empathy, because you think, basically everybody is perceiving all of this information that they're not realizing. And when they're trying to communicate with each other, for instance, or to show love to each other, a lot of times things that are happening in the subconscious mind are intervening. Or, let's say there's a lot of times where people will still be struggling with things from their childhood that they don't know about subconsciously, and that might make it hard for them to interact with certain people. And so, I guess learning about your subconscious, learning about what is really there, it opens up a lot of empathy, and it opens up a lot of... Go ahead.
Yeah, so I just wanted to remind you that one of the first uses of the subconscious I did therapeutically is I would ask your subconscious, is it okay for me to push Pierce to do something against his OCD would be against? And he'd said yes, then I would tell you, Pierce, go do this, something that makes you uncomfortable. And I actually, your subconscious helped me guide you, which was another wonderful feature of the subconscious. So, Pierce, thank you so much for sharing so much about your OCD and how you helped yourself with that. And we come back after this break, we're going to talk about how you used hypnosis to help dealing with pain, which I think is also very, very informative. So this is Centerpoint with Dr. Ron Anbar.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit HealthyLife.net's advertiser page and click on Audiobooks to get started.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services. So much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
HealthyLife.net, where positive overcomes negative.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
More exhilarating talk. HealthyLife.net.
Welcome back to Center Point. Today I have the privilege of interviewing one of my long-standing patients, Pierce, who shared with us how he has used hypnosis and interaction with the subconscious to improve his OCD over the years. But he's had some other health problems, including abdominal pain, for which he's used hypnosis. Maybe, Pierce, maybe you could tell us a little bit about the pain you're experiencing and then how you used hypnosis and maybe the subconscious to change the experience of pain.
So, this is something that I can actually really talk about right now because it's something that I'm currently experiencing, whereas a lot of the OCD stuff that I was dealing with and going through, that was 6 years ago. So it's like my mind isn't as present there. But for the pain, I can tell you right now, so I'm experiencing some upper abdominal pain right now without getting into the sources because I really want to just talk about the hypnosis. I had just recently talked to you in a session about what could I do in order to help myself with the situation. You told me a few things that I hadn't tried before that I was really interested in. When we talk about hypnosis, we're talking about using the subconscious mind to change something. And you had told me, the first thing that you had told me is that we could imagine that there's an army of white blood cells, basically, and that I could direct it towards where the pain is, and then, maybe imagine some imagery, like it building a city, or repairing the damages of a broken down city, kind of reflecting, changing things, like how you talk in your book about changing the color of pain or something to that effect. Another thing you said was you recommended that I imagine, let's say, building, like in the game Minecraft, one of my favorite games, just building blocks. Both of those things, I feel like it was a good start because it allows you to imagine the visualization of it. The second thing was imagining, like, healing light or healing, coming down, coating the belly where the pain is, and just imagining that anything that it touches, it's healing. And the third thing that we talked about is when you're having an adverse reaction, I don't know if reaction is the right word, but when you're having, some pain or some sort of something with a certain food, for instance, that it can help to imagine or visualize that the food is something much more mild. And doing all of these three things recently with the pain, it's not going to solve the pain. Obviously, if there's an underlying cause, you have to go and treat it medically, right? But what I have found is spending 30 minutes doing these visualizations, visualizing building, visualizing healing, visualizing the mild, calm foods, despite maybe something that normally would have less of mildness, has impacted me greatly.
What would happen, suppose you didn't know about hypnosis, where would you be, like, with your pain? How would you cope with it?
Hypnosis is a lot like meditation, but it's not meditation. And I use them together a lot of the time. Meditation was what I was doing before. But the thing with that is you get into a state of meditation that's kind of like getting into a state of hypnosis of calmness, right? But I feel like the hypnosis, it adds something to it. It adds this, I want to say, like, coating of relief, temporary relief, but relief. And sometimes, as you talk about in your book, that temporary relief can turn into something more permanent.
Have you done anything with your subconscious directly to help with the pain? Did you ask your subconscious to help? Did you ask your subconscious to explain, give you a different idea of how to deal with the pain? Anything like that?
Yeah, I mean, I've had things like that. I mean, usually the best thing that I find is just is to know what to eat. So, like, for instance, if I'm in a situation right now where I know that certain things are going to be harder to eat, I will, talk to my subconscious or my body even, like a conversation, listening to the intuition of my body and knowing, okay, so you get so in tune with the subconscious that it becomes kind of like this thing you don't even have to talk. It's just a feeling, right? So I would look at or smell something that I might want to eat, and I think, okay, well, I know that one's going to cause some pain today, but this one, I know it's not going to. And then that's kind of like, that's one of the things that I can do to like help with the pain.
So listening to yourself, reaching into your center is what you're talking about, helps guide you day to day or even meal to meal in terms of helping prevent the discomfort. Have you used hypnosis for other things that you found extremely helpful that you can share besides the pain and the OCD? Have you used it to help with school or focusing? Have you used it in interacting with friends? How else has it helped you?
You know, I don't have anything prepared to speak about, but I can tell you right now that I have. Lots of times. And I wish I had something more like in-depth to talk about. But I think the biggest thing right now that I've found that it helps me with is pain management, because when you're looking at being in pain, it's hard to imagine doing any of those things like studying or working or hanging out with friends. I've used the hypnosis primarily for just getting myself to a baseline feeling so that I can do those things, so I can continue on as I'm still working on the medical side of it.
Exactly. So, again, with pain control, just like with OCD, you learned to reach within you to help cope better. In the case of OCD, you've largely overcome it. In the case of pain, we hope you will largely overcome that as well as time proceeds and as you improve. You know, it's interesting. With the pain, it's the same philosophy. We need to take it a day at a time. You're getting better. It's going to take its same pace, whatever pace it needs to take. And my job is to support you along the way, which is true in our work together and is true in my work with many of my other patients, is the belief in the patient. The answer lies from within. And I think, as Pierce put it, the therapist's belief in the patient helps the patient believe in themselves and ultimately achieve the result they want or what they're seeking for. So that's the power of hypnosis. That's the power of the mind. So, Pierce, thank you so very much for joining us today and sharing some observations. I know we didn't rehearse this interview, so some of the questions were a little bit tough, but then I think your responses are very authentic, and we so very much appreciate your coming on the show today.
Of course. Thank you so much for having me.
Absolutely. This is Centerpoint with Dr. Ron Anbar.
Make-A-Wish has been granting life-changing wishes for children and families for over 40 years. A wish is something that gives children the opportunity to look outside their illness and restore a sense of childhood back to the child. With the help of donors and more than 43,000 worldwide volunteers, Make-A-Wish has collectively granted more than 520,000 wishes worldwide. Dr. Anbar has referred many patients to Make-A-Wish. To make a donation, go to worldwish.org. That's worldwish.org.
HealthyLife.net, the positive radio network.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
Reach your health and fitness goals. Whether you want to lose weight, learn to dance, build muscle, or just live healthy, Beachbody gives you unlimited access to the nation's most popular fitness and weight loss solutions. Visit our advertiser page and click on Beachbody now.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
HealthyLife.net, where positive overcomes negative.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services. So much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
All positive talk with a mature edge. HealthyLife.net.
Welcome back to Center Point with Dr. Ron Ambar. That was a great time we had talking with Pierce and learning about some of his journeys and how he overcame hurdles in his life as it was with the use of hypnosis and interact with the subconscious. So in this segment, I usually tell other patient stories. Today, I'm going to tell you a story about, actually this story is in my book, Changing Children's Lives with Hypnosis. It's a boy named Teddy, and he was 11 years old when I met him, and his complaint was that he started feeling a lump in his throat. Typically, I think it was during math class in school, and he started feeling he can't swallow. He would go to the nurse, he'd lay down for a while, and sometimes he had to go home, and sometimes he finally went back to class when the lump went away. So he came to see me. I was practicing as a pulmonologist at the time, so I examined him. His physical examination was normal. I then had him do a pulmonary function test, a breathing test, and that was normal. And then the question was what to do next. Now, without hypnosis in my tool bag, this is what I would have done. I would have done a chest X-ray to make sure there's no, and a neck X-ray to make sure there's nothing physical there. And we would have found nothing, I can tell you, because I know what happened at the end. And then I would have thought about maybe he has acid reflux. Maybe acid from the stomach has come out through his throat and is irritating the throat. That's causing the lump. So I would have maybe done a pH probe test, and that's you put in a wire down the nose into the stomach, and it measures the acid content in both the stomach and the food pipe, and see if there's evidence that he's spring up acid. And I know in this patient's case that we would have found nothing, and so then he'd still complain of a lump in the throat, and I would have done a bronchoscopy. And what that is under anesthesia, we would pass a scope into his airways to see what was causing the lump. And in this patient's case, I would have found nothing. So I would have done a whole medical workup, and at that point I would have said, I can't find a physical cause. You're probably okay. And many doctors do that with their patients. That's what I described. And the patient is saying, well, I'm not any better. Well, sometimes they feel better when the doctor says there's nothing physically wrong. But then sometimes they feel like, what, you're telling me it's in my mind? Are you telling me I'm crazy? I can't swallow. I have a lump in my throat. But fortunately, I knew about hypnosis. So before I started doing even the X-ray, I said, let's do hypnosis. Because if your symptom goes away, we don't have to do all these tests. And if the symptoms goes away, there's nothing physically wrong that needs to be fixed. So how would I address a lump in the throat? Well, first of all, I explained to Teddy what hypnosis is and is not. We've talked some about that already in this show, so I won't go into all the details, other than to make sure that you're aware that I told Teddy, as I tell all my patients, all hypnosis is self-hypnosis. You are in charge of this experience. And it works if you want it to work, and it doesn't work if you don't want it to work. All right, so that being said, I taught Teddy how to calm himself with hypnosis, and he got to pick a place where he would be calm, and he picked initially the moon. Some of you may think the moon doesn't sound very calm, but it doesn't matter what you think. What matters is what Teddy thought. So he imagined going to the moon. He imagined what he could see and hear and smell and feel and taste there. And I said that's sort of the platform that will help you relax. And then we talked about the symptom, the lump specifically. And I asked him, what did the lump feel like? He said it felt like an egg. All right. So when you feel the lump, imagine an egg and imagine swallowing it. That was the instruction. So that was it. I said, come back in a couple weeks and let me know how you're doing. So when Teddy came back, he said, hey, that really helped me. I used to feel the lump every day at school, but now it's only every week or two. Well, that's great, Teddy. How'd you do that? Oh, that egg was mighty delicious. Great. So then we talked about why, what can he do with the remaining lump that it was happening every couple of weeks, because eating the egg didn't help. So I asked Teddy what kind of image does he think would work for that, and he thought for a while. And we talked about maybe it felt like he had rock boulders in his throat. That's what the lump felt like. And so I asked him, well, what would make it go away? And he said, how about a river washing them away? I said, great. So if you have the lump, again, imagine a mighty river washing away the boulders. And that was hypnosis. And come back in a couple of weeks, he comes back, and he said, I don't have a lump anymore. It's gone. So by going to the moon, eating an egg, and washing away some boulders, his problem was solved. No x-ray, no pH probe, no bronchoscopy, no discomfort, no much money used, all because I had hypnosis in my toolbox. And I could teach it to Teddy in just a few moments. This is the power of hypnosis. This is why I wish every physician knew how to teach hypnosis, because life would be much better for our patients. Now, in the case of Teddy, I didn't even introduce the subconscious concept. I didn't ask why the lump was there, although I think the fact it happened in math class was a clue that there was some stress involved in math class. So if the lump did not go away right quick, I would have probably talked to him about the subconscious and asked the subconscious, is the problem indeed something related to math class? And we would have identified, is a teacher mean? Is a subject matter difficult? And then whatever the issue was, address it. So if it was a mean teacher, maybe we would have Teddy or his parents talk to the teacher. If it was the subject was too difficult, maybe we'd recommend that he get a math tutor. So sometimes it's really important to find out what the psychological stressor is that is causing the physical symptom. But that wasn't necessary in Teddy's case, because the symptom went away just with imagery of the moon, the egg, and boulders. And that's a simple example of how hypnosis can work. And I will tell you this for my medical patients, so patients presenting to me as a pediatrician or pulmonologist, 2/3 of the time, just learning how to relax and maybe a special image will resolve the symptom. And to me, that's always kind of miraculous. Well, I guess it's not a miracle in my mind anymore, because I kind of expect it. But you take patients who've had symptoms even for many, many years, and with these 3 simple steps, they resolve their symptom. It's incredible to me. And again, I wish they had known this years ago and spared them years of testing and feeling badly about themselves and worrying and feeling different than other kids. And there's a lot of baggage that comes from not giving our patients the tools they need to improve. So I'm hoping the listeners to this show will remember this, and if you're dealing with a medical condition or your child is dealing with a medical condition that's not improving, you should immediately ask, is there something psychological involved here? And the answer is usually yes. What we don't know is the psychology is affecting the symptom. And then tell the physician, hey, can we please take a psychological approach as well as a medical workup so we can get to a resolution as soon as possible. This is Centerpoint with Dr. Ron Unbar.
More than 30,000 children and adults of every race and ethnic group in the U.S. have cystic fibrosis. Cystic fibrosis is a disease causing long-lasting lung infections, limiting the ability to breathe over time. Dr. Anbar participated in research that helped advance survival of cystic fibrosis patients by more than 20 years. He encourages you to donate to the Cystic Fibrosis Foundation to help find a cure. It's easy to donate. Go to cff.org. That's cff.org.
HealthyLife.net, the Positive Radio Network.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
Constant Contact and your small business make a perfect fit for marketing. They give you what you need to succeed. Fast and easy email marketing at your fingertips. Visit the HealthyLife.net advertiser page and click on Constant Contact to start your marketing.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Radio your way. HealthyLife.net.
Welcome back to Centerpoint with Dr. Ron Unbar. This has been a very excellent show in that we've covered quite a bit about how hypnosis can help people deal with OCD, with pain, and trouble swallowing. And so for this last segment, we always teach you something you can do today. And what I want to go over with you is how to use hypnosis and imagery to calm yourself. We'll do it together in a few moments, and then you can teach this to your family members or your children with the message that you can use imagery and hypnosis to become calmer in times of stress. And this could be in dealing with discomfort, in dealing with school tests, in dealing with stressful job situations, even in dealing with grief. So in all of these situations, learning how to calm yourself can be very helpful. And so I'm going to just walk you through what I walk most of my patients through after I teach them about the power of words, which is what we talked about last week. So to do hypnosis, for calming, you get to pick an imaginary place that you would feel calm and safe in. This is going to be a place you've been to, a place you want to go to, even an imaginary place. And once you have this place in mind, in a few moments I'm going to walk you through how to calm yourself with it, but we're going to be using all of your senses, because every time you think of a different sense, it activates a part of your brain that actually senses that sense. So by covering all 5 senses, you are experiencing a whole brain activity. And also, every person has a different sense that they're strongest in. So by hitting all 5 senses, we're hitting your strongest sense. If you are not able to imagine exactly that sense, you can imagine what it might feel like, and it works the same way in terms of relaxation. All right, so when you're ready, think about that place where you'd be safe and calm and comfortable, and first think about what you might see there. Are there people there? Are you alone? What colors might you see? Are you seeing scenes of nature? Are you indoors? And then when you're ready, imagine what you might hear. Is it loud? Is it quiet? Is there music? Are there people talking or laughing? Are there sounds of nature? And when you're ready, imagine what you might smell. Is it perfume? Is it salty air? Is it a flower? Is it suntan lotion? And when you're ready, imagine what you might feel if you touched it. Soft, wet, grainy, warm. And then finally, imagine what you might taste. So if there was not food there, usually, hopefully you brought some food. So what you taste, is it salty, sweet, sour? And notice how the more you pay attention to different senses, the more relaxed you can become, the calmer you can be. And now I invite you to stay in this calm place for as long as you want. You can be there a minute, an hour, a year, forever. Time has no meaning. It's like a dream you're in charge of. So it only takes a few moments in real time. And when you're ready to come back from this imaginary experience, you can do so. But you can bring forward with you the calmness that you now have. And that calmness can remain with you for the next hour, day, or a week. And this is the exercise that helps 2/3 of my patients, my medical patients, get better. And if you enjoyed it, you can certainly go back to this broadcast and listen again to these instructions if you want the guidance, or you can do this on your own. All hypnosis is self-hypnosis. So if you just imagine that place and imagine all your senses, taking your time, you will feel calmer. And the more you practice feeling calmer, the easier it becomes. What you're teaching yourself is how to shift your mind from its usual state to a calm state. And that is a very useful skill to have. It's a very useful skill to teach your children and loved ones. And it's a basic way to reach into your center, because as you calm down, when you spend time in that calm place, you can better hear your inner self. And if you listen carefully in that state, sometimes great insight arises. If you want to speed the process along, you could ask yourself a question before you enter the calm state, and then wait in the calm state until you have a new perspective regarding your question. Now, I mentioned this works for 2/3 of my medical patients, which is distinct from my patients who are referred to me for their anxiety or depression. And the reason calming alone does not tend to help a great deal, it helps some, but not a great deal if you're anxious or depressed, is because these psychological issues typically are triggered by problems in the people's lives. Difficult family situation, difficult school situation, problems with peers. And in order to get a lot better, you need to talk and receive counseling about how to deal better with these life circumstances. That's why calming alone doesn't completely help, because just being calm doesn't make the life circumstances change. In the case of the medical patient who is stressed by their medical illness, and that stress causes the symptoms to get worse, just learning to relax addresses the stress reaction. So the stress causes a bit of anxiety, or the stress related to the medical situation causes the patient to tense up. And by learning to relax, that tension goes away and the symptom improves. And that's the reason there's a difference in terms of how helpful calming is with a medical patient as opposed to a patient dealing with a psychological problem. So, as you move forward in life and are facing challenges, remember, you can not control what the challenges are going to be. Challenges sometimes come out of the blue. But you can always control how, I shouldn't say always, but most of the time control how you react to that challenge. And this morning I talked to a friend who was telling me that he's had painful experiences and he can't do anything about it. And I said, no. I said, pain is pain, but suffering is optional. You can control how you react to pain. And that is a very empowering statement that we should all keep in mind. Thank you so much for joining us today. This is Centerpoint with Dr. Ron Anbar.